So this is part 2 of our phobias lesson in the unit of psychopathology, which is on paper 1. We're going to look at behavioural treatments for phobias in this lesson, and there's 2 that we'll focus on: systematic desensitisation and flooding. Before we begin, I'd like to recap what we learnt last lesson. So there's a couple of exam questions here, 5 marks in total. Should take you about 6, maybe 7 minutes to answer these questions. So pause the video, and have a go at these questions. Okay, so first question, outline a behavioural explanation of phobias. So you've either got classical conditioning or operant conditioning, and use some of the keywords associated with that. So classical conditioning, you want neutral stimulus, unconditioned response, conditioned stimulus, conditioned response, the idea that it's an association. And then for operant conditioning, you would have negative reinforcement and positive reinforcement. You might have the idea that it's a 2-process model, and you might have said that it involves classical and operant conditioning, but you just need a little bit of an outline of that. I'll show you the mark scheme in a second. And then our second question, briefly discuss one limitation of the behavioural explanation of phobias that you've outlined to your first question. So if you've done classical conditioning, or operant conditioning, it doesn't matter, because you can use the same evaluation points if you're saying that it's too simplistic and it ignores cognitive factors, so you can use that for both. If you've used classical conditioning, you could use the idea that not everyone can recall an incident, therefore it's hard to verify whether an association has been made between a stimulus and a response because they can't recall that event. You could also say that it ignores the idea of biological preparedness, and this would suggest that some phobias are more likely to be made through association than others, so that one links to classical conditioning again. So you can see the mark scheme here. I'm sorry, it's quite small, but you can pause this and you can zoom in and you can have a go and mark your questions, or if you want, you can just send me a picture of it and of your answer, and I'll mark it for you. So we've looked at behavioural explanations for phobias, and now we're going to look at behavioural treatments for phobias. So this is the idea that if an abnormal behaviour is learnt through association, then what we can do is we can counter-condition this. And there's 2 ways in which we do this. Systematic desensitisation is the first, and then a different way is flooding. But both of these involve replacing that fear response and getting rid of that fear response. So we're counter-conditioning it, we're reversing what has happened originally. So we'll start with systematic desensitisation. This is the idea that we would replace the fear response with a healthy response of relaxation, and this happens in stages. So I've got 5 stages here. You might have more or less in your revision guide, but it doesn't matter as long as you've got the key stages in there. So you might want to pause it, make some notes, but I'll run through it as well. So the stages. The first stage, the patient is taught relaxation techniques. And then the second stage, the patient and the therapist develop a hierarchy, so a fear or desensitisation hierarchy, This goes from the least fearful stimuli to the most fearful stimuli. So if we stick along the topic of clowns, then it would be maybe thinking of a clown or seeing a picture of a clown, all the way up to touching a clown or dressing up as a clown yourself. That would be the most fearful. That would be the thing that would cause you the most fear and the most anxiety. So then what happens? You've got your hierarchy that you've developed with your therapist, and you've practiced your relaxation technique. So you know how to relax, and you know how to control your pulse rate, and you know how to lower that. And then you've got your hierarchy as well. What happens in stage 3 is the therapist and the patient work through the hierarchy from the least fearful stimuli initially. So you would say, take that picture of a clown, you would think about the image of a clown in your mind, close your eyes, visualise this, and breathe until you could bring your heart rate down, until you saw that stimuli and it no longer initiated a fear response. So eventually you would be able to think of a clown, or close your eyes and see the image of a clown, and you wouldn't feel fear. You would be relaxed, okay? Your heart rate would be low. Once you've mastered that step, so this is stage 4, you move on to the next one. So from a picture of a clown, it might be to having a clown's makeup kit in front of you, or a clown's wig in front of you, or outfit, something like that. So then you would move on to the next stage, and you would continue to do the same thing. So for each stage, you would it would get more fearful, it would cause you more anxiety, you would practice your relaxation techniques, and once you could enter that stage and not feel fear anymore, then you move on to the next one, until eventually, which is stage 5, you master your hierarchy. You've gone all the way from the least fearful stimuli to the most fearful stimuli, and you feel relaxation. And you can apply that in real life. So you can go out, you can go to children's parties, you can go in fancy dress shops, and you no longer feel fear. So this is the final stage, and this is when the fear response has been replaced with relaxation. So to recap, systematic desensitization is when we replace the fear response with relaxation. There's 5 stages, and the key things to recall from these stages is that it involves relaxation. We have a desensitization hierarchy from the least fearful stimuli to the most fearful stimuli, and then they have to master each stimuli and be able to relax and not show a fear response before they can move on to the next. So we have some research support for this, and this was looking at people who had a fear of flying, and they took part in systematic desensitization, and they found that 93% of people after the program agreed to take part in a trial flight, and they had lower anxiety levels than those in a control group who didn't have the systematic desensitization. And they did a follow-up, which is quite good. They looked at them again 6 months later, and they found that those who had made a significant improvement continued to not show a fear response with regards to flying. In evaluation, so we can use the research support as evaluation because that's a strength of systematic desensitization. It shows that it does work, so you can link that back to yesterday's lesson saying that treatments are effective, which shows that the behaviourist approach to phobias, or behaviourist explanation for phobias, is a valid explanation. Then we've got a different side, so this is a little bit of a limitation of systematic desensitization, and this is the idea that it might not be effective in treating all phobias. The researcher here suggests that it doesn't really work very well for fears that are deep-rooted and have a survival component. So that's the idea of preparedness. So maybe these associations are too strong and too deep-rooted because they're essential to our survival. Therefore, systematic desensitization is not enough to counter-condition these phobias. So we've got some strengths and some limitations, and I'll just recap that now. So in evaluation of systematic desensitization, the research support shows that it is effective, and this was looking at people who had a fear of flying. They took part in the systematic desensitization program, and 93% of them were willing to take a trial flight, and most of them 6 months later, compared to a control group, didn't show a fear response. However, it doesn't work for all phobias, especially these phobias that are essential to our survival or have a survival component, like a fear of heights. And this could link back to what we did in the part 1 lesson of biological preparedness. It could link to that. So I've got an exam question for you to have a go at. So you can pause it. It's 4 marks. Have a read. You've got a little bit of an item there, and it's an explain how question, so you need to go through in a fair bit of detail, and you need to have the stages when you're answering this question, but make sure you're applying it to the item throughout. So 4 marks, maybe 5 minutes. Okay, so if we have a look at the mark scheme, you'll see that we've got this idea: she must be taught to relax, which is one of the initial stages. Then she must develop a hierarchy, and you have to suggest parts of this hierarchy, because you have to show that you've been linking it to the item. So you have to mention about cats, so it could be like an image of a cat, and then she could work up to stroking a cat. And then you have to explain how she would go through that. So she would go through each stage, starting with the least fearful. She would relax at each stage until she'd mastered that stage, and then she would move on to the next, which was more fearful. Okay, and eventually the association between the cat and fear would be replaced, and this fear response would be replaced with a response and a feeling of relaxation. So our next method of treatment, next behavioural treatment, is flooding. So this is a little bit more intense than systematic desensitization. Systematic desensitization is a gradual process. It's still quite quick, but it is quite gradual. Whereas flooding is very, very intense. What we would do is we would put an individual in a room or in a situation with their phobic stimuli straight away. So instead of working up to being in a room with a clown, if we were doing flooding, we would take this person, we would stick them in a room with a clown, we would leave them there for 3 hours and see what happened, basically. And the idea is, this isn't in vivo, so this is actual exposure. The idea is that you would be put in that situation and you would constantly be feeling fear, but nothing would be happening. So this is the idea of extinction, and it would get rid of your fear response, because you would be exhausted. You would be so fearful, and it would be consistent within this flooding session, which might be 2 or 3 hours, and you would realise that nothing was happening and you weren't experiencing any harm, that clown wasn't doing anything to you, and therefore that response would just be null and void. So the key things to remember about flooding is it's one long session which can last between 2 and 3 hours. You cannot avoid your phobic stimuli, you are directly faced with them, and it is often one of your most fearful situations. And this therefore leads to extinction, where you will learn that that phobic stimuli is harmless because your fear response is exhausted. So in evaluation, flooding's a lot quicker than systematic desensitization, but there are some ethical issues. Because we're putting that person in a situation where they're going to have an extreme fear response, this can be very dangerous, and sometimes it can actually make the phobia much worse. I like to often use the example of I'm a Celebrity, when they put someone in the box with all of the snakes and the spiders if they're really afraid of them. That's a really good very, very extreme version of flooding, which wouldn't happen in real life, but there are ethical issues with that. And you can see when you're watching I'm a Celebrity the fear on that individual's face, and you can see how it's making them feel, and that could make someone's phobia a lot worse. So often therapists don't want to give someone this treatment. They would rather use systematic desensitization than flooding, because it's not a very ethical method of treating someone who is suffering from a phobic stimuli, but sometimes it might be a last resort or a first option. So just to recap, in evaluation, flooding's good because it's quick, but it's bad because there's ethical issues and it can cause more harm and make someone's phobia a lot worse. So I've got an exam question for that as well. 2 marks, so 2 to 3 minutes. Outline how flooding might be used to treat a phobia. So just think about what keywords you're going to include in that. So pause it, have a go at the question. Okay, so we'll have a look at our mark scheme here. You can see there it says content, so these are the keywords that you need to have in there. You don't need to have all of them, but you need to have this idea that it's full exposure, it's direct or it's immediate, so you're faced with that phobic stimuli and you can't escape it, so that's your prevention of avoidance. And the fear is extinguished because that person cannot escape. Actually, I didn't mention it out loud, but it is on the PowerPoint slide, just that they must practice relaxation techniques. So this is something that's similar to systematic desensitization. Relaxation is important for flooding as well, so they need to have these techniques before you put them through the flooding process, so that they've got that mechanism to try and calm themselves down. Sorry. Okay, so we're going to do an overall evaluation of behavioural treatments. We've done a little evaluation of systematic desensitization and a little evaluation of flooding, but then we've got an overall evaluation. So sometimes this can be sort of like if you're outlining and evaluating each in a 16 marker, so you outline one, evaluate it, outline the next, evaluate it. This can be quite good as an overall kind of like concluding evaluation to bring them both together and look at the idea of behavioural treatments as a whole. So a good thing about behavioural treatments as a whole is they're relatively fast and they require less effort on the patient's part. So it's a really good therapy as well, because you can take on board what you learn, these relaxation techniques, you can apply it in real life, and now you can even get apps that try and help you do this yourself, or sometimes they're using like VR, so virtual reality, to do systematic desensitization, especially for people who have PTSD and who have been in war zones. What they can do is they can use VR to put them in that situation again, and they can work through the hierarchy and use that as part of the hierarchy. There's some really good research online. If you have a look, you can find out how systematic desensitization is used in lots of situations. So it's good, it can be self-administered, it is relatively cheap, and it is quite effective most of the time. But a bad thing about behavioural treatments is that we might actually just be treating the symptoms and not the cause. So remember last lesson we said that the explanation was too simplistic and it ignored cognitive factors. Well, the treatment ignores cognitive factors also. And if there is a cognitive factor there, then maybe we need CBT to treat that person. Also, there could be a biological explanation. It could be that some individuals are more prone to developing phobias, and you could link this into the diathesis stress model. This is the idea that some people might have a more overreactive sympathetic nervous system. So when they're faced with a phobic stimuli, or a stimuli in general, they would have a higher fear response, and therefore they're more likely to develop a phobia. So some people might get bitten by a dog and be absolutely fine and not have a phobia of dogs, whereas other people get bitten by a dog and then they develop a phobia. It could be that these other people, their nervous system is more reactive, and therefore the fear response that they feel initially is a lot stronger. Or it could be that these people have a faulty thinking mechanism anyway, and then when they're faced with that phobic stimuli of the dog, it just kind of goes into overdrive. Okay, so just to recap, our overall evaluation, it's good because it's quick, it's easy, you can do it on your own, and you can apply it to real life. But it's bad because there's ethical issues, which we mentioned with flooding, and we might actually be focusing on the symptoms, not the cause. It's not an all-round therapy because the behaviourist explanation is not an all-round explanation. So there is a 16-mark question on the PowerPoint for this topic. I'll run through that in another video as well, if you want to have a go at that 16-mark question. And then once you've done that, you can attach it to your assignment. If you want to send me a plan, I can have a look at that also. If you've done all of that, then you can have a go at the quiz on Google Classroom. Thank you.